Good morning, Mrs. Jones. How are you doing? My name's Renee. I'm going to be your nurse for the day today. Just got our report and heard a little bit about you. I know that you like to be suctioned fairly frequently. I can actually hear a little bit of mucus going on there. So I came in with my supplies. We're going to go ahead and suction you. And then I think what we're going to do is change that trach dressing. Looking a little dampish. You've had this all done before? Yes? Awesome. Before I start talking about all of that, let me just check your ID. You are Geraldine Jones, your date of birth is 5/10/63, and you have no allergies, right? Is that correct? Awesome. The other thing we need to do before we go too far into this is we need to establish a type of communication. You've been shaking your head yes and no while I've asked you questions. I just want to make sure if that's going to work for you. The other thing you can do is either do a thumbs up or a thumbs down as we're doing the procedure, because maybe shaking your head won't be back and forth, or up and down won't work while we're working in this area. So if you want to give me a thumbs up for everything's going good, or a thumbs down when I need to stop, just do that for me. You're good with that? Awesome. All right. So no allergies. You're Geraldine Jones. We've got our established our communication. Let me just tell you a little bit about what I'm going to do. Everybody sometimes does this a little different, but the order I'm going to do it in is I'm going to give you a little extra oxygen before we suction you, because we want to make sure that you're oxygenated well. We'll suction you out. When we are done with that, if you need more oxygen, I might give you a little more oxygen. If you don't need it, we'll move right on to changing out that dressing for you and getting that all freshened up. And it looks like your trach stabilizer is a little damp as well, so we'll change all of that. Before we do that, I'll get a friend to help me with that. And then we'll get you all put back together and you'll be all good as new. So until the next time we have to suction you. So do you have any questions about what we're about to do? No? Awesome. All right, so let's kind of check everything here at the bedside before I even take anything or move anything around with you. First of all, I want to check for my emergency equipment. We have 2 trach sets, one the same size you have, and one that's a little bit smaller. We have an extra inner cannula. We have our oxygen and suction hooked up and all ready to go. Before we start the procedure, I'll probably change out that catheter because I don't know how long that catheter has been up there. So it looks pretty good though. So what we'll do is you just relax for a second. I'm going to put some gloves on. We're going to clean the table off and get you all ready for the procedure, okay? Do you have any questions? No? Awesome. All right. Let me get a pair of gloves here. Let me clean my hands really quick. Put some gloves on and get started. How's your day going today? I know it's just started for me, but you've been here for a few days. Awesome. Have you had many visitors? Oh, your granddaughter has come by. That's awesome. Very cool. Well, that doesn't tear very nicely. Okay. I'm going to move these supplies over here for a second. Go ahead and wipe off our table. Alrighty. Okay, table's wiped down. We're going to let that dry, and we'll be able to use the table. Alrighty. Okay, so while that table's drying, we're going to get everything all set up and ready to rock and roll. Okay, my table has dried. It's been 2 minutes. We'll just put all our supplies down here. Okay, alrighty. So now what I want to do is clean my hands again really quick. Put some gloves on. I want to assess your lungs really quick. Just want to know if we've been effective with your suctioning. Okay, deep breath in. Deep breath in. Deep breath in and blow it out. Deep breath in and blow it out. Okay, your lungs sound good, but I do hear some upper airway noise there. It sounds like that your trach is got some secretions in there, so we'll be able to take care of that for you. Okay, so let me check our oxygen and suction really fast. Okay, I'm gonna go ahead and take that off of there before we start. Let me check this. Okay, that seems to be working. Alrighty. Okay, our oxygen is up at 15 liters. All right, let's go ahead and take this off. Put a brand new one on. Okay, we're going to check that suction. And the suction is going up. I see it at like 120, which is great. Okay, so that's ready to go. There's our little box. Whoops, it opened upside down. All right, cool. There we go. Okay, this looks good. We've listened to your lungs. Everything looks great. I'm going to go ahead and take these gloves. Well, we'll go ahead and take these gloves off. We've been touching a lot of supplies here. Okay, I'm going to use no-touch technique as one way to do this. I'm going to take these gloves out of here. I'm going to put this drape on. Shiny side down. Okay, great. I'm going to drop this inner cannula in. Okay. Alrighty. That over there. This, and this. We will open this up. We're going to pour water in here. We're going to pour water in there. All right. We can open that later. Okay. I think we're just about ready to go. Okay. All right, Mrs. Jones, we're going to go ahead and take this oxygen collar off and give you a little bit of bump of oxygen before we get started so that you can have some extra reserves before we do this. All right. All right, ready? Two, three, 4, 5, 6. 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. Okay, saturation looks good. Looks like it's right around 96 to 97%, so we're in a pretty good state here. Okay, we're going to get ready to suction you. The before we suction, let's go ahead and check to make sure it's functioning okay. Okay, that's working good. All right. I'm gonna advance that a little bit. Alrighty. All right, we're gonna go ahead and suction now. All right, awesome. How'd that feel? Good? Feel like it cleared out a little bit? It looks like it, and your saturations have stayed up, so that's really great. I'm gonna go ahead and get ready then to move forward into removing your trach tube. Okay. Let's go ahead and put the other one in. All right, awesome. I'm gonna go ahead and take off this old soggy dressing while I'm here before I put your oxygen back on. Okay, cool. All right, we're good. So now what I'm gonna do is go ahead and put some things in the water really quick. Let's get rid of this. Oop. Put that there. Let's get a couple of dressings in the water. We want to make sure we leave one to dry with. Okay, and split causes over here. Let's go ahead and pull those. All kinds of stuff in here that I can't, for some reason, pick up. Still doing okay, Mrs. Jones? Your oxygen looks like it's still staying up, and you look like you're breathing easier. Awesome. Thumbs up. Okay, I'm going to go ahead and take that collar back off, and we're going to clean the site for you, okay? Okay, so first we're going to swipe underneath. One swipe. And we're going to do another swipe. Great. Okay, let's clean underneath a little bit. Good job. One more underneath. Good job. And one on top to just kind of get some of the schmutz off the trach. Looking good. It's all polishing up nicely. All right, let's dry the area for you really quick. Get under here a little bit and dry everything off. Looking good. Okay, now what we're gonna do is we're gonna go ahead and put a brand new fresh dressing on underneath. All right, that looks amazing. How are you feeling? Good? All right, awesome. I'm glad we could make that work for you, and it looks really nice and clean and fresh now. Awesome. Okay. Alrighty, let me put that oxygen collar back on for you. We're gonna go ahead and get this drape off of here for you. Okay, now all we need to do is change these trach ties because they are a little on the soggy side. So I'm gonna get some help to do that. How are you feeling? Okay? All right, thumbs up, thumbs down, thumbs up. Fabulous. Do you feel like we got enough of that suction out, or the mucus out and everything? Awesome. Your sats are still staying up. I think what I want to do is go get my friend because we don't want to change this without having some assist. So I'm going to go ahead and do that. So I'll be right back. Let me make sure that you are in a safe position with your call light and your bed is down and we're good to go. Okay, be back in a little bit. Hi, Mrs. Jones, we're back. I brought my colleague Linda to help me with your trach stabilizer change. Linda?
Hi, how are you? Nice to meet you.
Thumbs up. Looks like she's happy to meet you too. So she's going to help me. It's a safety issue. If while I'm taking that stabilizer off, if you were to cough unexpectedly, we could actually dislodge your trach. So Linda will be here to help stabilize the trach while we make the changes of the necktie. So I'm going to go ahead first though. Your oxygen looks good. You seem to be breathing pretty well. I'm going to go ahead and take off your oxygen collar so that that's out of our way for right now. And then Linda's going to stabilize the trach while we go ahead and do this real quickly for you, okay? All right. Take off this old one. We'll close up the Velcro so it doesn't catch on its way around the back of the neck there. I'm gonna go, you know what? I think I'm gonna fold this over. It makes it a little bit easier to get it through the loop. Okay. Let's go ahead and do that. Let's try not to have too much gauze in here. Okay, now I'm going to push this through, the old one to the other side, and then the new one over to the other side. And we'll let Linda pull it through. While I'm doing that, I'm checking your neck, and your neck looks phenomenal. No redness or damp areas, no open areas, looking great. So I'm gonna stabilize this while Linda pulls everything through for me. And then I'll change this other side. There we go. All right, you got it? Or maybe come down here so you're not on her face. Awesome. All right, let's get rid of that. We'll put that in the garbage. Let's get our new one. Let's see if we can go ahead and just put this in real quick. Almost done here. Alrighty. All right, that looks really good. We're gonna go ahead and put your oxygen collar back on. Linda, if you can grab the other end there for me. Did you get it? There you go.
Maybe.
Maybe.
Oh, it's stuck underneath your
There
neck.
we go.
There we go.
All right, thank you so much for your help, Linda. I appreciate it.
You're welcome. It was so nice to meet you, Mrs. Jones.
All right. How'd that go for you, Mrs. Jones? Awesome. Okay. Before I leave the room, let me just take a listen to your lungs one more time, making sure that you're in a good space. Your oxygen saturation is still up around 97%, which is really great for you. So let's take some deep breaths. In and out. In and out. In and out. And in and out. All right, that sounds phenomenal. You sound great, and I don't hear any upper airway noise. So I think you're in a good space. Sats are good. You're breathing normally. Is there anything else I can do for you while I'm here today? Okay, you feeling pretty good? Awesome. Don't need anything? Super. Okay, well, we're going to put up our side rails. We'll put this one up. We'll put this one up if it wasn't up already. And we'll go ahead and lower your bed. All righty. Here's your call light. If you need anything, just give us a holler. I'm going to get this suction catheter off your bed really quick. Okay, and everything looks like it's in good space. All right, I'm going to go document what we did and clean up my stuff. Mrs. Jones, have a really great rest of your day, okay? Okay, I'm going to document that Mrs. Jones had her tracheostomy dressing changed. There was no signs and symptoms of infection. We changed her cannula without any issues, and changed her trach stabilizer. She's stable, looking good, and we'll check on her a little bit later. Thanks.